Thank you for this honor of presenting my work, Joint Prediction of Motor and Non-Motor Deep Brain Stimulation Outcomes using Quantitative Susceptibility Mapping. I'll first introduce Quantitative Susceptibility Mapping, or QSM, which is an MRI contrast derived from the phase of gradient echo acquisitions. QSM is used in deep brain stimulation, DBS, presurgical targeting, in the treatment of movement and psychiatric disorders, after reconstruction in a process known as dipole inversion. The resulting map provides an estimate of tissue susceptibility at each voxel. QSM is commonly used to depict iron concentration, so it provides superior visualization of many DBS targets. Since this presurgical map is available for target localization, my co-authors and I wondered if we could predict surgical outcomes from radiomic features. These radiomic maps provide information about the iron distribution in deep gray nuclei, which have been linked to disease progression and symptom severity. Check out this poster for more details. Once the features were extracted, a regression model was fit to predict outcomes for each patient. The joint model learns weights to express motor and non-motor outcomes as a linear combination of radiomic features. This idea has been investigated by our group and others for motor and non-motor outcomes separately in a variety of imaging modalities. To our knowledge, this joint prediction is unexplored. We begin by plotting the levodopa response as a baseline for 19 patients undergoing DBS in the subthalamic nucleus. The correlation between levodopa and Unified Parkinson's Disease Rating Scale Part 3, or UPDRS-3, is known to be limited. And neither motor UPDRS-3 nor non-motor Beck Depression Inventory outcomes correlate with presurgical levodopa response. However, we show significant correlation in both motor UPDRS-3 improvement and BDI non-motor improvement with our model predictions in this preliminary study. In summary, we hope presurgical QSM can be further investigated to predict DBS outcomes. And we have published our code and welcome collaborations. Finally, I'd like to thank our funders who have made this work possible. Thank you for your attention.